The 8 most common human blood types explained. Blood type is usually mentioned only when someone has a health checkup, donates blood, becomes pregnant, or needs a blood transfusion. On a test result, it appears as a very short symbol such as A, B, or O+. Yet behind those 2 or 3 characters lies a complex identification system that determines whether the body will accept or fight blood cells introduced from outside. The 4 letters A, B, AB, and O are determined by the presence or absence of A and B antigens on the surface of red blood cells. The plus or minus sign indicates whether the red blood cells carry the RhD antigen. When these two systems are combined, they produce the 8 familiar blood types: A+, A-, B+, B-, AB+, AB-, O+, and O. These 8 types do not represent the entire world of blood groups. As of the May 2026 update, the International Society of Blood Transfusion recognizes 48 blood group systems containing hundreds of different antigens. However, the ABO and rhodium systems remain the 2 most commonly used in routine blood testing and transfusion medicine. This article will explain how each blood type works, which red blood cells it can receive, whom it can donate to, and why no blood type is truly better than another. This article is intended for general educational purposes and does not replace laboratory testing, medical advice, or professional decisions made by a transfusion service. 1. A positive blood, a plus. A plus is like a door marked with the letter A that can still open for red blood cells, both with and without the RhD marker. The red blood cells of a person with a plus blood carry the A antigen and the RhD antigen. Their plasma usually contains antibodies against the B antigen. This means that if the body is exposed to incompatible red blood cells carrying the B antigen, the immune system may identify them as foreign and launch a reaction against them. Everyone has an immune system that distinguishes what belongs to the body from what comes from outside. During a blood transfusion, however, this recognition process can become dangerous if a patient receives the wrong red blood cells. A person with a plus blood cannot simply receive cells from anyone merely because all blood looks red. Under the basic ABO and RhD classification, a person with a plus blood can receive red blood cells from A+, A-, O+, and O donors. A+ red blood cells can be given to people with A+ and AB+ blood. One common misunderstanding is that the plus sign means this blood type is stronger, healthier, or of higher quality than a negative blood type. The plus sign only shows that the RhD antigen is present on the red blood cells. Being rhodium positive is an inherited characteristic, not a measure of a person's health. In everyday life, most people with a plus blood do not feel any physical difference. Their blood type becomes relevant mainly when they donate blood, need a transfusion, or undergo certain medical tests. Donated A+ blood can be especially useful for patients with A+ and AB+ blood. A+ does not define who you are. But in a hospital, that small symbol helps doctors know which immune system door can be opened safely. 2. A negative blood, A- carries the A marker on its red blood cells, but lacks the RhD badge found on positive blood types. A person with a minus blood has the A antigen, but does not have the RhD antigen on the surface of their red blood cells. Their plasma usually contains antibodies against B. Because RhD is absent, exposure to rhodium-positive red blood cells under certain circumstances may cause the body to produce antibodies against the D antigen. Under basic ABO and RhD transfusion principles, A person with a minus blood can generally receive red blood cells only from a minus or O donors. In the other direction, a minus red blood cells may be given to people with a minus, A plus, AB, and AB plus blood. The ability to donate to both rhodium-negative and rhodium-positive recipients gives a minus red blood cells a broader donation range than a cell's. Rhodium-negative status is also particularly important during pregnancy. If an Rh-negative mother is carrying an Rh-positive baby, her body may form antibodies against the D antigen if the two blood supplies come into contact under the right conditions. In some cases, these antibodies can affect the fetus. Modern medicine, however, offers monitoring and preventive treatment under a doctor's supervision. This does not mean that a woman with a minus blood will inevitably experience pregnancy complications. Blood type is simply one factor that must be tested and managed, not a sentence. Many Rh-negative women have completely normal pregnancies when they receive appropriate screening and care. A minus is not a weak blood type. It simply requires more careful selection when the body needs red blood cells from another person. 3. B positive blood, B plus. B places the B antigen on the front line, like an identity card that the immune system reads before deciding whether to accept or react. B plus red blood cells carry the B antigen and the Rhd antigen. The plasma of a person with type B blood usually contains antibodies against A. Therefore, giving red blood cells carrying the A antigen to a person with type B blood can trigger a dangerous immune reaction if the mismatch is not detected and prevented. Under basic ABO-RHD matching, a person with B plus blood can receive red blood cells from B plus, B minus, O plus, and O donors. B plus red blood cells can be given to people with B plus and AB plus blood. In everyday life, there is no visible feature that reveals whether someone has B blood. You cannot determine blood type by looking at a person's skin color, body build, personality, or athletic ability. The reliable method is to test a blood sample using appropriate blood grouping techniques. A common misconception is that anyone with a plus sign can donate blood to anyone else who is Rh positive. In reality, B plus red blood cells cannot be given to an A plus or O plus recipient simply because both are Rh positive. The A and B antigens remain a crucial part of compatibility. Imagine a patient with B plus blood who is losing blood and needs an urgent transfusion. Medical staff do not merely look for a blood bag carrying a plus sign. They must consider the ABO system, Rhd status, antibody screening results, and pre-transfusion cross-matching. B plus is not just the letter B paired with A plus sign. It is a combination of immune markers that a hospital must read correctly before a unit of blood enters the body. Psi, B negative blood, B minus. B minus has a narrow receiving range, yet its red blood cells can help both rhodium negative and rhodium positive people with B or AB blood. A person with B minus blood has the B antigen on their red blood cells, does not have the Rhd antigen, and usually has antibodies against A in their plasma. When red blood cells are needed, they can generally receive only B minus or O cells. However, B minus red blood cells can be used for people with B minus, B plus, AB, and AB plus blood. This limitation creates a special kind of dependence. People with B minus blood need B minus or O red blood cells, and neither may always be available in large quantities. If blood donation levels fall, compatible supplies for B plus patients can quickly become scarce. Yet being rarer does not mean being more valuable in terms of human worth. Every blood type is necessary because hospitals must maintain a supply that matches the needs of many different patients. A blood bank filled only with O units could not completely replace the roles of all other blood types in every situation or for every blood component. People with B- blood do not need to live more cautiously in everyday life. They can eat, exercise, work, and live like anyone else. Blood type does not cause symptoms by itself, and being rhodium negative is not a disease. B- becomes difficult only when time is running out and compatible blood is limited. That is why a single donation that seems small can become the bridge a complete stranger is waiting for. 5. AB positive blood, A+. AB+ carries nearly all the major markers of the ABO and RHD systems, making it the most flexible red blood cell recipient among the 8 common types. A+ red blood cells carry the A antigen, the B antigen, and the RHD antigen. The plasma of a person with AB blood usually contains neither anti-A nor anti-B antibodies. Therefore, when only ABO and RHD red blood cell compatibility is considered, a person with AB plus blood can receive red blood cells from all 8 common blood types. This is why AB plus is often called the universal red blood cell recipient. Its donation range, however, is much narrower. AB plus red blood cells can generally be given only to another person with AB blood. Because recipients with other blood types may carry antibodies against A or B, or may be incompatible with RHD. This contrast creates an easy misunderstanding. Being able to receive from many groups does not mean that AB plus blood can be given to everyone. In transfusion medicine, the direction of giving and the direction of receiving are not perfect mirror images. AB blood has another important role when plasma is involved. AB plasma contains neither anti-A nor anti-B antibodies, so it is commonly regarded as universal donor plasma. This is the reverse of red blood cell transfusion, in which O is considered the universal donor under the ABO-RHD system. Even though AB plus is called the universal recipient, an AB plus patient cannot be transfused carelessly. Hospitals must still determine blood type, screen for antibodies, and perform cross-matching, because hundreds of other antigens beyond ABO and RHD can affect compatibility. AB can receive red blood cells through many doors, but before any door is opened, the laboratory must still test the key. 6. AB negative blood, AB. AB combines the flexibility of AB with the limits of rhodium negative blood, allowing it to receive several negative red blood cell types but not positive ones under basic matching rules. AB red blood cells carry both A and B antigens but do not carry the RHD antigen. The plasma usually contains neither anti-A nor anti-B antibodies. Therefore, a person with AB blood can receive red blood cells from AB, A-, B-, and O donors. Their red blood cells may be given to people with AB and AB plus blood. You can imagine a person with AB blood standing before 4 doors marked with minus signs. They can pass through all 4, whether the label is A, B, AB, or O. But the plus sign remains a boundary that routine red blood cell transfusion should not cross. A common misconception is that AB is simply a rarer version of AB+. In reality, the absence of RHD significantly changes which red blood cells this person can receive. When supplies of rhodium-negative blood are limited, finding the right units can be more difficult, especially for patients who need multiple transfusions. However, the meaning of rare depends on population and region. Blood type frequencies vary between countries and communities. A percentage reported in the United States, Canada, or Europe should not automatically be applied to the entire world. ABB does not feel different inside the body nor does it automatically create a health risk. Its practical significance appears in emergency rooms, blood banks, and moments when compatibility must be accurate down to the smallest marker. ABEEB shows how a minus sign that appears tiny can redraw the entire map of red blood cell transfusion. 7. O-positive blood, O+. O carries neither the A nor B antigen, but it does carry RhD, a combination that allows its red blood cells to serve many Rh-positive recipients. In the ABO system, Group O red blood cells carry neither the A nor the B antigen. The plasma of a person with type O blood usually contains both anti-A and anti-B antibodies. In O plus blood, the plus sign shows that the RhD antigen is present on the red blood cells. A person with O plus blood can receive red blood cells from O plus and O donors. O plus red blood cells can be given to people with O plus, A plus, B plus, and AB plus blood. This makes O an important red blood cell source for a large proportion of Rh-positive patients. But O plus is not the universal donor. If O plus red blood cells are given to an Rh-negative person, the RhD antigen may become a target for the recipient's immune system. Ignoring the plus sign and looking only at the letter O can therefore lead to a dangerous conclusion. It is also important to distinguish type O red blood cells from type O plasma. O red blood cells have an advantage because they do not carry A or B antigens. O plasma, however, contains both anti-A and anti-B antibodies. The rule that O can donate to everyone cannot be applied to plasma, whose compatibility pattern works in the opposite direction. People with O plus blood do not have cleaner blood or a superior immune system. The absence of A and B antigens is simply an identifying feature of their red blood cells, not a certificate of bodily quality. O plus cannot open every door, but in the healthcare system, it opens many doors that need to be opened every day. 8. O negative blood. O is like a lifebuoy used when there is too little time to ask what blood type a patient has. O red blood cells carry none of the A, B, or RhD antigens because these three major markers are absent. O red blood cells are less likely to be attacked by a recipient's anti-A, anti-B, or anti-D antibodies. Under the ABO and RhD systems, O is therefore considered the universal red blood cell donor and can be given to people with any of the 8 common blood types. This is why red blood cells are often used in emergencies when a patient is losing blood rapidly and medical staff have not yet had time to determine the patient's blood type. Having O units available can allow doctors to begin resuscitation without waiting for the full blood grouping process to be completed. Yet people with O blood have the narrowest receiving range. They can generally receive red blood cells only from O donors. If a person with O blood needs a large volume transfusion, compatible supply can quickly become a serious concern. The term universal donor must also be understood correctly. O is not completely free of antigens. Beyond ABO and RhD, red blood cells may still carry many antigens from systems such as KEL, Duffy, KID, and MNS. Patients must therefore still undergo antibody screening and cross-matching whenever circumstances allow. The International Society of Blood Transfusion currently recognizes 48 blood group systems, showing that transfusion medicine is far more complex than the 8 familiar symbols suggest. O can be given to a great many people, but when someone with O blood needs to be saved, only one door is open to them. Conclusion: the 8 common blood types are not 8 ranks, nor do they represent 8 kinds of people. They are 8 common combinations of the A, B, and RhD antigens found on the surface of red blood cells. A, B, AB, AB, O, and O each have their own role. Under basic ABO-RHD matching, AB+ can receive red blood cells from all 8 groups, while O can donate red blood cells to all 8. Yet having a broad receiving range does not mean having a broad donation range, and a blood type that can donate widely may be able to receive from only one type. More importantly, the rules described in this article apply only to general red blood cell compatibility. Plasma and platelets follow different principles. Real transfusion decisions also depend on antibody screening, cross-matching, previous transfusions, pregnancy history, and many antigen systems beyond ABO and RHD. No one should attempt to select or request a blood product solely from a compatibility chart found online. Blood type does not determine a person's value or personality, but when a life depends on a compatible unit of red blood cells, those small symbols become a language the immune system understands more clearly than any spoken explanation.